My name is Jason Schmidt, and I am a primary care physician at a VA clinic in rural Northwest Montana. I think the stigma that a lot of primary care physicians carry with them is such that they view addiction in general as being something that is completely volitional on the patient's part. It's self-imposed, they're doing it to themselves. Won't they just learn? But it's way more complicated than that. And it's complicated because there are genetic factors, there are biological factors, certainly social factors. You know, we very seldom have that same judgment towards someone who is diabetic or who has high blood pressure and is struggling with their blood sugars or struggling to get their pressure under control. When that call for an early refill is coming for the third month in a row, instead of thinking, boy, I'm just going to taper them off, or I'm just going to cut them off from these medications, instead to be able to look at it and think, okay, this person's really suffering. What is going on here? They're sending me all the signals that they need more help. Sometimes we have to draw hard lines in the sand and say, okay, you know, I'm not going to support your opioid addiction by continuing to prescribe oxycodone, but I'd like to talk to you about some other treatment options for folks who have opioid use disorder. I think an important thing to be aware of are just stigmatizing terms. Terms that we used to throw around pretty freely without giving much thought to them. For example, you know, reviewing someone's toxicology results with them and referring to it as dirty or clean. You know, those are terms that just feed right into a lot of the stigma associated with addiction. Or referring to patients as addicts. I think the way that we talk about this problem affects all of us, providers and patients, because our words are absolutely what either perpetuate stigma or deconstruct it. That's been a real game changer in terms of perspective change for me, and I think my patients have picked up on it. And at the end of the day, I'm much more satisfied with what I'm doing than what I was 5 years ago when I'd finished days just frustrated beyond belief about how many narcotic prescriptions I had just filled.